Dr. Myers.
Hi, Miss Escobar. Nice to see you.
Good to see you, too.
Have a seat. I have all your records here, and I understand you have some questions to go over today.
I do. So what is considered normal blood pressure?
Normal blood pressure is under 120 over 80. Above 140 over 90 is what's called high blood pressure, or the other word for it is hypertension. So you're right in the middle. You have what's called prehypertension. Your blood pressure, the top number is 138 and the bottom number is 85.
What do the two numbers in my blood pressure mean?
You have two numbers, as you said, and I think a lot of patients, such as yourself, know the numbers but really don't know what they mean. So it's important to understand that. The top number, which is called the systolic blood pressure, but simply remembered as the top number, is when your heart beats and pushes out blood up to your head, down to your legs, all over your body. The bottom number is when the heart expands. That's called the diastolic blood pressure, or just remember it as the bottom number. And it's when the blood is flowing back into your heart, filling your heart. But both numbers are very important because, once again, think about your pipes at home with water. And if the water is running through at too high pressure over time, could damage the lining of the pipes or cause them to burst. So same thing with the blood vessels here. You have blood vessels in your head, in your brain, in your eyes, in your kidney, your heart, your kidneys. So important that the blood pressure, both top number and bottom number, are well controlled. If you had high risk factors, for example, if you had diabetes or you already had a stroke, then even in that prehypertension, we would really consider starting a medication soon.
And if I go on medication, will I have to be on medication my whole life?
Well, people who have prehypertension or just mildly elevated blood pressure, many of them, through making lifestyle changes, can actually bring their blood pressure to goal. And if not, if you have many risk factors, for example, if you've already had a stroke or if you have diabetes, generally we want to be more aggressive with your blood pressure and perhaps go on a medication and stay on it. Many people who do require medications do require them for life. There's several medications, as you know, and we've talked about them too, that work in different ways. So there are something called a diuretic or a water pill. Many of the names are Lasix, hydrochlorothiazide, chlorthalidone. Then there's also something called ACE inhibitors or ARBs, and they're nicknames for the longer. ACE inhibitor means that it stops an enzyme or a process in your body that makes your blood pressure too high. There's also medicines called beta blockers. Metoprolol is one name. There's three things that I emphasize, and the first one would be diet. So diet, not only a heart healthy diet, and there's something called a DASH diet, DASH. And if you go home, put it in your browser and you'll have a lot of information on it. It's a diet that has been shown to actually have an effect equivalent to some medications and has helped bring many people to goal. So it emphasizes fruits and vegetables. Now, the other good thing is to watch your sodium. So a lot of people say, well, how many milligrams? And how can I keep track of my milligrams as I'm going throughout the day? So I have some simpler ways to take care of that. And one is, don't use a salt shaker. I know in some baking, you do need some salt, but don't add salt. Don't put it on the table. The other thing is to look at what you're buying. Fast foods, and many of us, especially in New York, go out and grab some fast food for lunch that has a lot of hidden salt or sodium in it, and a lot of sauces, prepared foods, processed foods. Well, many people, not all, are what's called salt responsive, meaning that making a change in the amount of salt they eat can lower their blood pressure. You've probably heard on the news that's why in New York City it's become a big topic about reducing salt. So salt or sodium is in your diet. The first thing I tell everybody is to try to not use the salt shaker. And then the other thing is when you take out foods or buy prepared foods, there's a lot of salt hidden in fried foods, in fast foods, and in the sauces that come with them. Now, the other thing that's very important, for example, I always keep a can here. On the bottom of a can or on the side, it's listed sodium. And what I tell people to do is look at that. It will say what percent of salt or sodium is in one serving. So if you see that there's 40%, 50% of the daily sodium or salt in that one serving, it's probably too much. Do you walk to work?
I do. I
Very
walk
good.
to work and I walk home. Is that enough?
That's physical activity, and it adds up. So how far is your walk to and from work?
So 15 minutes to work,
Right.
and then a 15-minute walk home.
All right, so that's very good. And I also tell people on their lunch hour, go for a walk. Or if you have errands, don't take the bus, walk. Also use the stairs instead of the elevators. Or if your family is going on a vacation, go on a vacation where there might be hiking or other outdoor activities. As far as an exercise program, generally anything my patients say they'll do and stick to is important. So while we do say that 3 to 5 times a week, 30 minutes of getting your heart rate up is ideal. If a patient says, well, I can commit to 3 times a week doing rapid walking or going to the gym, riding a bicycle, all of those are good activities. I think the best thing is to get a plan to be more active and stick to it. And I recommend that some people like to check it every day, but the main thing is to not get too overly concerned about it and obsessive about it, but measure it a couple times a week or every other day. All right, so very good, and I see that you've lined it up correctly, and this is the indicator right here. Let's make it just a little bit tighter here, okay? There we go. All right, so you want to be able to just put slide a finger underneath, have this completely lined up, which you do. Very good. Let's see what it is today. Well, actually, we know what it was just a couple minutes ago, but let's see how you're doing. And you'll see the numbers flashing and the little heart flashing there as well. And then you'll see the top number. There you go. So very good. You're at 135 over 82. So I think sitting a couple minutes too has brought it down. So good. So let's have a trial of 3 months. And you're going to be at the gym, working out, making the diet changes, and losing some weight. So if after that you're still not at goal, we'll give consideration to a low dose of a medication.